Hello everyone. The topic of my presentation today is sodium hypochlorite and endodontics. So in a gist, we will see how it is manufactured, what is the mechanism of action, the various actions, that is the antimicrobial, tissue dissolving property, actions on smear layer and other actions, the various concentrations in which it is used, as well as its toxicity and complications. It is the most popular irrigating solution used as an irrigant for well over many decades. It was first recommended by Henry Dakin in 1915 and was called as Dakin solution during the time of World War II. This solution was buffered with sodium bicarbonate and used for the treatment of the infected wounds. Let's see the manufacture of this sodium hypochlorite. Historically, the solutions were produced on a commercial scale by passing chlorine gas through a solution of sodium hydroxide. But in more recent times, electrosynthesis of sodium hypochlorite has become a standard practice. Currently, sodium hypochlorite is manufactured by electrolysis of a sodium chloride solution. A 15% solution of sodium hypochlorite of pH 12 to 14 is produced by this method, and it is diluted by deionized water to produce solutions which meets the retailer specifications. Other agents such as perfumes, surfactants and thickening agents may be added. Commercially available household bleach, Clorox 5.25% available chlorine, was first recommended by Louis in 1954 and has since gained wide acceptance. Other suggested brands include Hypo, which is a 5% available chlorine, and Sainsbury's household bleach, that is the 3% available chlorine. Sodium hypochlorite is best known for its antibacterial activity. Studies have generally shown that sodium hypochlorite has a broad spectrum antimicrobial activity. It can rapidly kill vegetative bacteria, spore-forming bacteria, fungi, viruses, and bacterial spores. Some investigations showed the ability of even 0.5% sodium hypochlorite to kill bacteria to a greater extent than other irrigants. So let's see its mechanism of action. Destruction of the bacteria takes place in two phases. First, by penetration into the bacterial cell. Second, by chemical combination with the protoplasm of the bacterial cell. In water, sodium hypochlorite dissociates into sodium and hypochlorite ions. Between pH 4 to 7, chlorine exists predominantly as hypochlorous acid, whereas above it as hypochlorite ions. It is the hypochlorous acid that is responsible for the bacterial inactivation. The bactericidal ability of hypochlorite results from the formation of hypochlorous acid when in contact with organic debris. This exerts its germicidal effect by oxidative action on sulfhydryl groups of bacterial enzymes, which in turn disrupts oxidative phosphorylation and other membrane associated activities as well as DNA synthesis. As essential enzymes are inhibited, important metabolic reactions are disrupted, resulting in the death of the bacterial cells. So in this flowchart we can see the protein present in the bacterial cell wall is hydrolyzed by the hypochlorous acid, which in turn the protein is denatured into amino acids. These amino acids on combination from the chlorine from the hypochlorite become chloramines. These chloramines are the organic substrates which interfere with the cell metabolism, finally causing the cell death. Smear layer is produced every time a canal is instrumented, which is composed of organic and inorganic components, bacteria, necrotic tissue, and pulpal remnants. Sodium hypochlorite alone is not very effective in the removal of smear layer as it does not affect the inorganic material. Hence, it is removed in association with ethylene diaminic tetraacetic acid, which complements the action of sodium hypochlorite by chelating calcium ions in dentin and making instrumentation of the root canal easier, especially in the narrower canals. Let's see the advantages of sodium hypochlorite. The ability of the hypochlorite to dissolve organic soft tissue of the pulp. It is well recognized to be effective against a broad range of pathogens, gram-positive, gram-negative bacteria, fungi, spores and viruses, including the human immunodeficiency virus. Also, it helps in gross debridement and flushing out of debris in the canals, and it removes smear layer when used with the PDTA. Let's see various disadvantages of sodium hypochlorite. It causes acute inflammation followed by necrosis when it comes in contact with the vital tissues. That is, when it extrudes out of the apical foramen in the root canals. Also, it causes hypersensitivity and irritation to the eyes. It is very corrosive in nature. So on carbon steel instruments. So if left within a syringe, it may crystallize, jamming the plunger. Also, it may crystallize the root canal walls. Let's see how the physical properties affects the solution. It is degraded by light, air and contaminants. Always a fresh solution has to be used while using it as an irrigant in endodontics. This is the most important topic in sodium hypochlorite, that is the sodium hypochlorite toxicity. A 1% concentration of sodium hypochlorite provides sufficient tissue dissolution and antimicrobial effect, but the concentration used has been as high as 5.25% because of enhanced antimicrobial activity. As the concentration used rises, so does its toxicity. Numerous reports have described clinical complications because of the improper use of sodium hypochlorite. Sodium chloride is a cytotoxic agent. When it comes in contact with the vital tissue, it causes hemolysis, ulceration, inhibits neutrophil migration, and damages endothelial and fibroblast cells. Irrigant, when it comes in contact with the patient's or operator's eyes, it results in immediate pain, profuse watering, intense burning, and erythema. Its management is done by ocular irrigation with large amounts of tap water or sterile saline. Also, the patient should be referred to an ophthalmologist for further examination and treatment. So let's see what happens when sodium hypochlorite is injected beyond the apical foramen. These are called as sodium hypochlorite accidents. This usually occurs in teeth where the apical constriction has been destroyed during root canal preparation, or due to the resorption of the root canals at the apex, or it may occur in teeth with wide apical foramina. Additionally, the solution can go beyond the apical foramina by extreme pressure during irrigation or binding of the irrigation needle tip in the root canal. This results in contact of large volumes of the irrigant to the apical tissue. So if this occurs, the excellent tissue dissolving capability of sodium hypochlorite will lead to tissue necrosis. Let's see the various symptoms. First is the pain. Immediate severe pain in 2 to 6 minutes. After that, immediate edema of the neighboring soft tissues happens. Possible extension of edema over the injured half side of the face, upper lip or infraorbital region is possible. After this, there is profuse bleeding from the root canal or profuse bleeding with hemorrhage of the skin and mucosa, which is called as the echinosis. Chlorine taste and irritation of the throat after injection into the maxillary sinus may be experienced by the patient. Secondary infections are possible. Also, reversible anesthesia or paresthesia is possible during the sodium hypochlorite toxicity. So let's see what is the management for this. For the dentist, he has to remain calm, inform the patient on the cause and severity of complication, immediate irrigation of the site with normal saline to dilute the hypochlorite in order to reduce the soft tissue irritation. Second thing is the pain control. Immediate relief of acute pain by giving a local anesthetic nerve block. Also giving analgesics such as acetaminophen. In severe cases, referral to hospital is must. So in this case, prescription of antibiotics is not obligatory, but in cases of high risk or evidence of a secondary infection, amoxicillin of 500 milligrams can be given. Antihistamines can also be given but are not obligatory. Corticosteroids can also be given, but their use is controversial in this case. Usually given corticosteroids are dexamethasone as well as methylprednisolone. For the reduction of swelling, we can use extraoral cold compress for first 6 hours, followed by warm compresses and frequent warm mouth rinses to be done after that. As we see, prevention is better than cure. So, it is better to prevent the sodium hypochlorite accident than to treat it. So, there are various steps to prevent them. First thing is proper isolation using rubber dam, adequate access preparation to facilitate better access, good working length control, irrigation needle placed 1 to 3 millimeters short of the working length. The needle can be bent so as to confine the tip of it to higher levels in the root canal. Needles be placed passively and not locked in the canal. Irrigant to be expressed into the root canal slowly and gently. Flow back of solution as it is expressed into canal should be observed. Constant in and out movements of the irrigating needle into the canal space to be done to ensure that the tip is free to express irrigant without resistance. In case of any resistance felt, irrigation to be immediately stopped. Use of side delivery needles are specifically designed for endodontic purposes is advocated. The hub of the needle should be checked for tight fit to prevent inadvertent separation and accidental exposure of irrigant to the patient's eye.